And now, Dr. Kryger's lecture program starts right now.
This is my daily supplement protocol. Basically, there's over 96 nutrients in here. This product here, Boswellia, is a fantastic product because 70% of all our inflammatory cases go into cancer, heart disease. So this one hits a lot of inflammation in the body. Plus they use it as a drug over in Europe for ulcerative colitis. There's also a chemical in here that also is 10 times stronger than any chemopreventative that they use for breast cancer and different products. So that's why I picked that, because this is an inflammation. This product actually, there's an integrative library that I probably subscribe to and put on my webpage and all that, but we do all this research. I mean, they got so much information. But when I looked up Boswellia, it got a rating of an A+ and that's for a food supplement. So that's pretty tremendous. The biggest thing is it got an A+ for osteoarthritis. And osteoarthritis is low, chronic, inflammatory. So that's why I put that in there. Let me show you. Multivitamin is perfectly fine. I already have a multivitamin in here, but this is a pretty good article to explain that a lot of these studies are pretty flawed. And you'll see as we go along, I'll point out the research that we need to use a lot of heavy pharmaceuticals, especially for sleep disorders. There's other ways to do it, and I kind of present that case through people that have already done it to their patients and through the research. So I thought this was kind of interesting because they're always saying, vitamins kill you and all kinds of stuff, but 130,000 people is a lot for just a multivitamin. This is the Boswellia. I looked this up there's a physician's desk reference on the internet, and these are all the properties of Boswellia. So basically, anti-allergic, we have all our anti-cancer stuff. Here's anti-barbecue, chemopreventative, immunomodulator, differentiator. So it's a tremendous product. That's why I put it out there. But most people don't know you can get value from taking these no matter what condition you have. Especially, I would use this one for general anti-inflammatory in the body. This is my web page. What I'm going to be doing is I'm going to be making a members page, and in that members page there's going to be all kinds of recommendations for people that want to apply nutrition and nutraceuticals and herbs and vitamins and minerals and all that. So I have over 200 health conditions that I put together that are in the background for that member site. For instance, here's one. For example, there's GERD, which is gastroesophageal reflux disease, moon phase, growing pains. This is the most people don't know you can enhance performance exercise just by adding this root that improves exercise performance. Here's the Boswellia. The vitamin that people have never heard that heals is basically vitamin U. And then the nutrients that stops reflux or vomiting in babies. This is a big one for me because my first son spit up all the time. Projectile vomiting. He was just all the time. And we used to go, I must have spent like 200 hours on Mylicon drops. So, and what I found was that this product, the biggest thing with babies is their fatty acid metabolism is the last thing to develop as they're becoming a baby, as they're moving through development. So they can't use fats, so they're actually going to spit it up. So if you use a product, there's a product that I use, it's called L-carnitine, that your baby will not spit up because he can metabolize the fatty acids. So that's actually an amino acid deficiency. And a lot of us have this because how many people have GERD, gastroesophageal reflux disease? A lot of people. So it's just a way to cheat, get to the problem, and treat it. So, and then I got all my newsletters, lectures, everything. So I got so much information in there. And then what I'm going to do is when people do that, I'm going to have this done in about a month or 2 months at the latest. But then when people sign up, I'm gonna get them this book, Why Your Doctor Offers Nutritional Supplements. Most people don't even know you can use nutritional supplements for different disease processes in the body. I mean, basically, it's just biochemistry. So I was going to do that. This was a study that just came out. Sugar may be killing you. Basically, if you increase your daily calories of 21% with high fructose corn syrup, maple syrup, honey, molasses, all those, your chances of having heart disease go up 38%, higher risk. So carbohydrates, or, so I'm a big advocate of, not doing a 60 to 70% carbohydrate diet, which is pretty high. This is, now, for sleep is a big issue. 40 million Americans suffer from chronic, long-standing sleep disorders. Another 30 million have occasional problems getting or staying asleep. Sleep disorders often remain unidentified and undiagnosed. So we're going to go through, there's about 70 sleep disorders. We're going to go through just a couple of them that I think I can make the most impact nutritionally by putting people on a program. 1 out of 15 adults suffer from moderate and severe forms of disorder. And then of the 4, heart disease, cancer, and stroke, and obsessive pulmonary have to do with sleep apnea. So it's sleep apnea can lead into heart disease, stroke, and chronic obstructive pulmonary, not cancer. It doesn't lead to cancer, but sleep apnea can lead to heart disease. How many use one of those thermometers for the breathing instruments? For sleep apnea, you put the machine on your face. Anybody use that in here? You got a pretty healthy bunch. I have a lot of patients that use that. I'm like, there's ways you can do. It may take a little bit of time, but there's things you can do to get off that thing. Sleep compromises 1/3 of our lives. Basically, we sleep 20% less than 100 years ago, and it's probably higher than this, because this it's probably about $20 to $30 billion just in sleep problems. Most people catch up on their sleep over the weekends. Would everybody agree with that? And when do you catch up with your sleep? What do you do?
I take a nap.
Oh, yeah, naps. The biggest thing I have with a lot of the sleep agents out there is the side effects of sleeping pills. Okay, most people don't know their side effects. They're in the tiny print, but basically, common side effects of prescription sleeping pills for Lunesta, Sonata, Ambien, Roserum, Helcan may include burning or tingling in the hands, arms, feet, or legs, changes in appetite, constipation. And this happens more than people realize. So this is a major issue. You could have gas, weakness, stomach pains. And then this was kind of interesting. The FDA requires manufacturers of Ambien and Zolpidem to offer lowest doses for women. Women clear the drugs from their systems more slower than men, which is kind of interesting. So the drugs could still be high enough where in the morning it could affect their activities during the day or their job. So, and also lower the dose in men. It's kind of an oxymoron with sleep medication because some of the sleep medications they give you raises your cortisol levels, which is your stress hormone. And that's the hormone that actually won't allow you to get you sleep. It gets you all revved up. So cortisol is the primary stress hormone produced by adrenal glands, highly energized. In some vulnerable detoxifiers, SSRIs, which are serotonin reuptake inhibitors, withdrawal triggers an abnormal cortisol surge that exacerbates anxiety and insomnia. This is also true of Adderall, Ritalin, all those medications. So a lot of these kids that need to be on ADD medication, ADHD medication, they also have sleep issues. This was pretty interesting. It says America's #1 prescription sleep aid could trigger zombies, murder, and other disturbing behavior. It says the warning in small print that medications and hypnotic have occasional side effects, sleepwalking, abnormal thinking, strange behavior. These behaviors are listed as extremely rare. Sleep driving. Are they serious? Sleep eating. I've heard, donuts in the kitchen with the sugar on the floor. You woke up and you ate in the middle of the night and you didn't even realize it. And then sleep shopping, I don't know what that's about. So, but Ambien is a tough one to, most of the time people put it with alcohol. This is a Hollywood drug. With sleep, the pineal gland, which is in the brain, releases melatonin. Then melatonin induces people to fall asleep. When melatonin wears off, most of the people, they awaken. I don't like, most people use melatonin to sleep. I haven't had much success with it. And the reason that I haven't is because melatonin is more for transition times, going from time zones, changing time zones. It works the best for changing time zones. So people take melatonin for sleep. It might work, everybody's a little bit different, but I use it mostly for time zones. There's other things you can use that are better than melatonin for sleep. Here's the categories of sleep disorders. Dysomnia, you have insomnia, basically is the inability to fall asleep or stay asleep. And then you have hypersomnia, which is the ability to sleep too much. And then you have sleep apnea. Then you have narcolepsy. Does everybody know what narcolepsy is? It's when you get really tired during the day. They had a big article on that probably 2 years ago where the flu vaccine, one of the side effects of the flu vaccine was narcolepsy. Circadian rhythm disorder, and then parasomnia, brain wakes up even though the person is still asleep. Sleep terrors, sleepwalking, sleep talking, teeth grinding, and bedwetting. And these are the more neurological, psychological, psychosis, alcoholism, and depression. Why is sleep so important? Sleep is a necessary restorative and reparative process. Sleep basically resets about 11 neurotransmitters in your brain. So if you don't get any sleep, those neurotransmitters can get faulty, and that can lead to irritability. That's why they use sleep for torture. I mean, it's very effective. Sleep is an active process for the brain. Here's some medical causes of insomnia. Pain's a big one, maybe low back pain. You can't sleep because your back hurts you. Maybe you got neuropathy where your nerves are irritated and you can't sleep. Cardiovascular, cause of insomnia, that would, cardiovascular angina, people that had trouble breathing. Pulmonary is COPD, chronic obstructive pulmonary disease, where they can't breathe that well. And then gastrointestinal, I've had GERD before, gastroesophageal reflux. And man, does that wake you up in the middle of the night. Has anybody ever had that? I had it one time with some French onion soup. I had some French onion soup about an hour before I went to bed. And it was just churning in my stomach. And man, after about 2 or 3 hours, I had to hit the toilet. That was it. Genital urinary, a lot of people have insomnia because a lot of men have BPH, benign prostatic hypertrophy, or they have to wake up in the middle of the night to go to the bathroom. Endocrine, a lot of females have menopausal issues, they can't get to sleep. That's because a lot of times with sleep, it raises prolactin, and that prolactin level raises estrogen. And if you don't have enough estrogen, that can cause a hot flash to cause you to wake up. Neurological, there's a bunch of them in that. Restless leg syndrome. Anybody have restless leg syndrome? Basically at night. Restless leg. What's neat about restless leg syndrome is 20% of all the restless leg syndrome is iron deficient. So if anybody has restless leg syndrome, that's a nutritional deficiency. Okay. Also folate deficiency, which is B9. And there's a lot of, because a lot of times they'll put you on different medications. They'll gabapentin. They got a bunch of different medications that they use. But these are all, some of these are secondary. These are primary. Folate and iron are primary. Pregnancy is secondary because you don't stay pregnant your whole life. Varicose veins, diabetes, thyroid problems. Parkinson's disease is secondary. And Sjögren's is autoimmune. And celiac. We've heard so much about celiac. Celiac is basically everywhere. Which is basically your gluten, gliadin, and protein. Those prolamines you can't digest. And then rheumatoid arthritis. This was kind of interesting. Many restless leg syndrome patients have a disorder known as periodic limb movement disorder, or PLMD, which causes repetitive jerking movements of the limbs. You ever have that when you were in your first phase of sleep and you just, you just jerk? And if that happens too much, in one study, accounted for 1/3 of the insomnia over the age of 60. Jumpy, shaky legs, whole body jumps when asleep. That's a riboflavin deficiency. It's as simple as that. You don't need a muscle relaxant. We don't need all these, different products or drugs, but basically this is a riboflavin deficiency. Sleep deprivation, basically everybody knows short-term, slow reactions, irritability, weakness, hallucinations. Long-term, that's a big one. They got a couple studies out that if you ain't sleeping right, it could make you obese or overweight. Brain damage, depression, and diabetes. How much sleep do we need? Basically, infants sleep for about 16 hours a day. That's a lot. And 50% of infant sleep is in REM, which is rapid eye movement. We'll go over that in a second. And teenagers need about 9 hours of sleep on average, and adults 7 to 8 hours for best results. About 50% of persons over 65 years of age have frequent sleeping problems. That's huge. If you're feeling drowsy during the day, even at a boring activity, you haven't had enough sleep. These are the phases of sleep. Stages one and 2 usually take about 15 minutes, 10-15 minutes. most of us like to have a glass of wine or have some pills or drink, and we miss this phase. This phase is pretty important. It kind of initiates the rest of the phases. Then what happens is stage 3 and 4 is 20 minutes then to 45 minutes. And in these stages, there's thinking, there's muscle tone present. DTR is deep tendon reflex activity. And then EMG to the activity in the limb muscles. So your muscles are active. When we move over here from non-REM to REM, which is rapid eye movement, it happens between 90 and 120 minutes. From when we fall asleep, go through all these stages, then between 90 and 120 minutes, REM lasts about 20 to 30 minutes. It's basically enhanced respiration, blood pressure, rapid eye movement, loss of muscle tone, vivid emotional dreams, and signs of sexual arousal. So this REM happens probably 3 or 4 times a night because you take 90 to 120 minutes through the night, depending on if you're sleeping. So it happens about 3 times. Non-REM sleep, these hormones are produced. So your non-REM sleep, growth hormone, which is so important for regeneration of the joints, all that stuff, growth hormone is secreted 30 to 60 minutes after sleep. Okay? Prolactin secreting beginning of sleep. So that's a lot of times, like I said, like some females where they wake up because they have a hot flash. Cortisol is created late in sleep, and then increased serotonin activity. And then around with decrease in dopamine. Basically what they do is, for sleep latency, these 2 latencies are for diagnosis. And you want to find out how long it takes you to get to sleep, how long do you stay asleep, how long do you oversleep. These are basically just sleep latency time it takes to fall asleep, usually 10 to 20 minutes. A lot of people have problems in that area too. They just, they just stare at the ceiling, or, it's not really recommended to watch TV while you're in your bed. You should sleep, and if you don't get to sleep, within 10 minutes, you should leave the room, go do something, and then come back. Maybe take a shower, go empty the dishwasher, go do something. Sleep maintenance, basically staying asleep, and then REM, latency, from falling asleep to continuing through the 4 stages of non-REM to REM, is referred to as REM latency. I refer to this one as the Nightmare on Elm Street, because that's when you're going to have all the fears and terrors and all that. And then sleep disturbances, reduced sleep latency. These are things you want to kind of get away from. Alcohol and drugs for sleep, reduce sleep latency. Sleep apnea. Everybody know what sleep apnea is? You can't get enough oxygen. Snoring, your esophagus closes, collapses. Your diaphragm has atrophied muscles. And then narcolepsy. Prolonged sleep latency. These are major depression. People don't want to get out of bed. Alcohol, we got all that. That's fine. And then aging and sleep. As we age, sleep changes. We lose a slow wave phase disappears in people over 75 years of age. We got a reduction in non-REM sleep in the elderly. It's kind of interesting how it changes. And then these are a lot of sleep disorders in people as they get older. These make up about 50% of the ones that they diagnose. These are the neurotransmitters. When you come into the office and you want to be tested, to test the brain, there's no real objective test. Okay? Some of them use electrodes and all that stuff, but there's not a lot of good ways to test the brain checking the blood is not very good because there's a blood-brain barrier. You don't even know if it's crossing. So what I do is for these neurotransmitters as biomarkers, I use the Acera testing for these. It works excellent. And basically, you want to see, which one's peaking, and we'll go through a couple of these. But glutamate, norepinephrine, dopamine, histamine, aspartic acid, and PEA, those are all excitatory. GABA, which is GABA-aminobutyric acid, glycine, serotonin, and taurine are all inhibitory. That Ambien is a GABA. Ambien's a GABA. Works on the GABA receptors, and GABA is a inhibitory neurotransmitter up in the brain to help you relax. It's basically relaxation. So if you have a GABA issue, all these things from nerve twitching, anxiety, trembling, feeling of dread, shortness of breath, hyperactivity, tachycardia, basically GABA gets used up pretty quick when we're stressed. So does serotonin. We'll go to that one next. But there's something you could do. This was kind of interesting. When you're GABA deficient, a lot of times you'll crave protein and carbohydrates. It's kind of interesting. GABA is have to do with seizures. Well, GABA could have seizure disorder. Here's some side effects. Ambien is benzodiazepine. Basically, it works on the GABA receptor that I just mentioned. You get amnesia, impairments in memory and psychomotor function. You get addiction, habituation. I didn't pronounce that right. Tolerance, reduce insomnia, withdrawal symptoms, and anxiety. So there's always a rebound effect from taking these medications. This is what I use. I came out with this probably about a year ago for biotics. And this is a GABA. This works on the GABA receptor. And if you read this, it contains GABA, a natural derivative of GABA. Phenobute has been demonstrated to have calming effect and may assist in instances of stress, anxiety, even improvement of impaired sleeping. However, due to its derivation of GABA, it appears to have no significant negative side effects other than the potential for increased sleepiness in some individuals. So it's a real good product, an alternative product you can use if you're having sleep issues and you don't have to resort to the sledgehammer medications. This is serotonin. Serotonin is another neurotransmitter. Basically, it's your happy neurotransmitter. This is a little test here. Do you have a tendency to be negative? See the glass half empty rather than half full? Do you have dark, pessimistic thoughts? Are you often worried and anxious? Do you have a feeling of low self-esteem? These are all serotonin. Serotonin is more your Prozac, your SSRIs, which they say. You find relief from any of these above symptoms through exercise. The best serotonin is actually exercise. So if you want to raise serotonin and you're feeling down and you're not feeling good, exercise is the best way to stimulate this neurotransmitter. And then suicidal thoughts or plans. They should pass that out in school.
Yeah.
They should force you to take it. This was kind of neat. You know, when you're looking at nutrition, most people don't realize that this study right here, according to the Lancet journal, a study was done to treat narcoleptics if they fall asleep during the day, which suffer from constant fatigue and sleep during the day with supplementation. Patients who were treated with supplemental tyrosine showed that within 6 months, every narcoleptic was cured from daytime sleep attacks as well as episodes of cataplexy. 6 months taking a supplement. Cataplexy is when you lose, your muscles just kind of give out, you become limp. But I think that's real impressive. Does anybody think that's impressive? I mean, has anybody heard that? I mean, it basically fixed it. So, good product. It's tyrosine works on the dopaminergic pathway, which is dopamine. A lot of your medications, like your Prozac and your SSRIs that raise serotonin, mess with dopamine. They cause twitches. And they think that twitches they create neurological damage, like eye twitching and lip twitching when you take these medications. It's happened to a lot of people. You just kind of blow it off. But it's pretty serious nature because it's messing with the dopamine pathway. If you mess with the dopamine pathway, you know, the first thing that can happen is it's basically Parkinson's. More people are getting Parkinson's disease. So you're always better going with something natural to support. But it took 6 months. How many people have patients for 6 months? Can they come into the office 6 times and it's not working, Doc. So it's not working. Second one, it's not working. I know it's not working. I know it's not working. So some of these things you got to be patient with as far as nutrition, but you'll fix the problem. This is 5-HTP, which is 5-hydroxytryptophan. This is basically serotonin. But it helps with insomnia, depression, cravings, PMS. You can have a lot of different issues with sleep problems. It could be one neurotransmitter. It could be another neurotransmitter. I'll show you, it could be something you ate the night before that created a problem in the brain. I'll show you how that happens. This was cool. This just came out on December 12th, 2013, three months ago. They said a key is branched chain amino acids, which are all humans produce from protein-rich foods in their normal diets. Research found that these amino acids fixed sleep disturbances in mice with traumatic brain injuries. It fixed it. We're not mice, but it fixed it. That just tells me, if you look at this kind of drew my attention because I help coach for hockey. And there's a lot of kids that get concussions. 20% of all your concussions can lead to serious issues down the road. And this would be a product that I would absolutely use for anybody has a concussion that's trying to recover. Just simple branched chain amino acids. Branched chain amino acids restore orexin neurons in the injured mice to a normal activity and improved wakefulness. These amino acids are present in high protein foods. What does everybody want you on? A high carbohydrate diet. Why don't we just go on a high protein diet? It's meats, poultry, eggs that keep neurons running smoothly, like oil in a car engine. They are also the building blocks of neurotransmitters and chemicals by neurons in the brain. So I thought that was kind of cool. This is the only product, this is the only unique product actually in the world. Okay, I found this product, I'm like, this is pretty cool. I didn't know anything about it. I started looking at it, it's called MAP, Master Amino Acid Protein. But basically, MAP is 99% digestible. So when you eat a peanut butter and jelly sandwich, you lose almost 50-55% of the protein because you can't digest it. This is 99% digestible. You have one with protein, especially whey, supplemental proteins. You have almost a 40 to 50% excretion rate of your proteins. And they call that the net nitrogen utilization. This product right here, your whey protein, your soy protein, all those proteins, especially what you eat, your net nitrogen utilization is probably 40 to 50%. That means waste. This net nitrogen utilization is only 1%. You only have 1% waste.
So you take that instead of a protein drink?
Right. Well, this, I just put that in there because, you know, I can give, because you can't give people that have kidney failure, or kidney disease, or different cancers, they don't have a lot of metabolic energy to digest protein. So I use this product because it's already pre-digested for you, it goes right into the system. So you don't have to digest anything. It's already done for you.
So again, you would use that, you know,
Yeah. For insomnia, neurotransmitter. This is a huge endurance athlete pill with bikers and triathletes and all that. The guy has the patent on this thing. It was pretty cool. But I thought that was pretty interesting that simple branched chain amino acids, we're all looking for the next drug, you know, the next chemical. It's basically, it was right there all along. Okay, this is neat. This is the red cell transketolase. In order to check thiamine levels, you have to get this red cell transketolase study. Red cell transketolase is blood work, okay? Now, I put this up there because most of the diagnoses is sleep apnea, insomnia, can't get to sleep, can't stay asleep. Basically, this doctor, what was his name? Lonsdale, Derek Lonsdale, he's an MD for Journal of American College, basically used thiamine to fix a lot of the sleeping disorders that we're talking about tonight. It says right here, it says, these individuals suffered from a wide variety of symptoms, which included excessive sweating, fatigue, nasal congestion, heart palpitations, sweet cravings, erratic temperature, postural hypertension, recurrent infections, violent mood swings, urinary frequency, restless sleep, headaches. Hat band headaches are thiamine deficiency. Night terrors, insomnia, paresthesia, cold extremities, diarrhea, bedwetting, chest pain, teeth grinding, hyperactivity. Each individual is given thiamine hydrochloride at 100 milligrams 3 times a day in adults and older children, and 50 milligrams 3 times a day in smaller children. Basically, you fix these kids. Just with thiamine. That's not good for medicine. That's bad news. So the issue is that a lot of these kids have, you know, their diets are too high in calorie. If you have a lot of carbohydrates, you got to have a lot of thiamine. They're running the thiamine levels now. It's causing lactic acidosis and neurological issues, especially with thiamine, because you have 50 trillion cells in the brain. You know, and how much glucose do we flood it with? If you don't have thiamine, you can't utilize the glucose for the brain cells. So you get all these symptoms. This is what I'd use for the thiamine. It would be the Bio-3-BG. Increased psychotic tendencies, apprehension, increased auditory, tactile, visual perception, nerves or neurosis, temper tantrums, hat band headaches, AM wake up, you wake up too early, seizures at night. This is huge. 45% of people that have seizures have them in the middle of the night. So seizures in the middle of the night are basically blood sugar fluctuations. So basically, their seizure issue is not 3 or 4 medications they're on, it's a thiamine deficiency. 3 tablets twice a day for 3 months. Now, this is more, I think this is more, happens more with people these days because histamine's a stimulant, and it stimulates the brain, okay? And if you have a sausage and sauerkraut meal with a big beer,
Sounds good.
right? Basically, what you're doing is, after you eat that, you're raising your histamine levels. So it's going to be very difficult to get to sleep. You might toss and turn all night just from histamine foods. So these are the things, high histamine, pickle or canned foods, sauerkrauts, tomatoes, matured cheeses, smoked meats, salami, ham, sausage, chickpeas, soybeans, peanuts, walnuts, cashews, chocolates. Chocolate's a big one for histamine. Citric acid for histamine. That's why when somebody comes in with allergies, what's the first thing I take them off? Orange juice, pineapple, and grapefruit juice. Because that's citric acid. And if you're trying to stop their allergies, why would you be feeding them foods to raise histamine? Because that's what they're there for. Vinegar, ready meals, salt, snacks, preservatives, artificial coloring, benzoates, sulfates, nitrates, glutamate, food dyes. These we'll see in a little bit, but all these are basically, in order to metabolize those out, you need vitamin B6. So if anybody's had like a MSG issue or a sensitivity to MSG or to any chemicals, B6 is one of the main things that helps metabolize that out of the body. So you don't have a problem. Low histamine foods. What do you think these are going to look like? Fresh, 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 fresh. Chicken skinned, fresh fruit, fresh vegetables, grains, milk substitutes, cream cheese, butter, most cooking oils, most leafy herbs, non-citric fruit juices, and herbal teas. Except for green tea, make tea, and black tea. I don't know what make tea is. Black tea and green tea, those raise histamine. Okay. This is an enzyme in the body that actually breaks down histamine. And some people, like any enzyme, like when you have a lactose intolerance, you need lactase, that enzyme to break down lactose, right? Some people have a little bit of the enzyme, some people have a lot of the enzyme, some people have none of the enzyme. It's the same thing with diamine oxidase. This enzyme, if it's not working or it's not functioning or it can't catch up because you're doing all these things, your dehydration, it raises histamine levels in the body. So this is the enzyme that actually breaks down histamine and gets it out of the body. So you can enhance that by, guess what, I got a remedy for that. Histoplex and Antronix, which are basically allergies, insomnia, food intolerances, poison ivy, itch, all that stuff. Even sleep. What do we usually give kids? You give them Dimetap to go to sleep. It's an antihistamine. Give kids antihistamines to go to sleep because they're all revved up. I don't agree with it, but that's what they do. This was neat. If you have sleep apnea, get your thyroid checked. Most people that have sleep apnea have a hypothyroid. The best way to check your thyroid is through a temperature reading to pick up, because this is not going to be your normal thyroid where you look at the blood work and everything's wacky. You got sleep apnea. It's usually everything looks clean. The numbers are a wide margin. And they're not going to be outside the lines, but they could be high or low, but they're still within the range. So using a temperature reading to pick up subclinical thyroid is the best way you can do to find out if they have a hypothyroidism. So thyroid has to do with metabolism, right? So in sleep apnea, they have problems breathing or oxygenating their tissues and saturating their tissues with oxygen. What controls that is the thyroid gland, because the thyroid gland helps you oxidize things, break things down. So that's what gives you your thyroid is what gives you your temperature, your increase in temperature. This was another one I got. Brain dysfunction, thiamine deficiency. It's same as Derek Lonsdale with a high calorie malnutrition. This guy basically, as Kurt Hamilton was interviewing him, what got you interested in thiamine and how long have you been studying the nutrient? But anyway, I discovered material that was totally forgotten from the early days of vitamin research, including the fact that infantile beriberi was a precise, exact facsimile of sudden infant death syndrome. Threatened SIDS was just being reported at the time, and I found that giving these infants thiamine stopped their recurrent nocturnal apnea and stopped their apnea alarms from terrifying their parents. Because your kid would stop breathing. He would breathe, then he would stop for like 10 seconds, and he'd breathe again. So basically, it's basically an excess of simple carbohydrates which is resulting in a high calorie malnutrition. So basically they fixed sleep apnea with thiamine. Now in an adult, is it going to be that easy? Probably not. It'll probably take a long time. It might take 6 months, but your chances of getting better, the research shows that you don't have to be on a CPAP machine. Get molested by a CPAP machine. I don't know how these people can sleep with that thing. All right, I want to show you this. This is kind of neat. This is Zorex B6, B1. Thiamine, basically, this is another combination you can use it other than just thiamine. This is B6, B1, but you need B6 for the biosynthesis of histamine, of GABA, of phenylalanine, of DOPA, of serotonin. So if you don't have vitamin B6, you can't convert any of these. So they might be dropping Prozac in your blood and giving you, through pills. It might be just a B6 deficiency. Something real simple. They tried to make B6 a drug. And they were real interested in it, and they almost passed it. They almost took all the natural B6 off the market out of the health food stores. Because they paid millions of dollars to do studies. And once they do studies and do millions of dollars, they have the right to choose what's good for you and what's good for me. But I thought that was interesting because serotonin, dopamine, and GABA, which are very, very important. And then look at B1, acetylcholine. What's the biggest thing with acetylcholine is your Alzheimer's. Literally. Acetylcholine is a neurotransmitter that helps you with memory and thinking. And then GABA. GABA to help you relax. We're all strung out. Here, vitamin B6 or pyridoxine plays a vital role, important roles in your body, similar to the other B vitamins. Helps your body convert food energy into glucose, metabolizes fats and proteins, and ensures proper function of your nervous system. With these various effects, there are ways in which your vitamin B6 status may cause or contribute to your sleeping difficulties or insomnia. Here's an easy way to go and see if you have a problem. But it says talkaboutsleep.com. They have a little sleep self-assessment quiz. Fill it out. If you seem like you're having a problem, come into the office. I like to also do hair analysis. Most toxicities, whether it's heavy metals or chemicals or anything, most toxicity in the body lowers GABA. GABA is used up very quickly with toxicity people. So if you have mercury, cadmium, arsenic, lead, aluminum, those could be substituting for your neurotransmitter conversion. So I do a hair analysis to check and see people how much their total toxic representation is. This guy's in trouble. This was interesting because I pulled this. This was from 1993, the Office of Alternative Medicine. And they said, basically, this is what my Acera is, my bioresonance testing. The NIH states that bioelectromagnetics essentially underlines biochemistry, that chemical reactions of biological importance are mediated by electromagnetic force. Bioenergetic medicine offers the possibility of more economical and more effective diagnosis and non-invasive therapies for medical problems, including those considered intractable or recalcitrant to conventional treatments. That's what my Acera is right there. Let's keep going. What else is on here? This is the Acera testing. Test takes 15 minutes. There's so many tests in there, but I got one set up for just sleep problems. If your sleep has to do with hormones, you can scan and see hormones, bioidentical hormones. Maybe your cortisol, DHEA, estradiol, maybe it's one of those that are thrown off. Most people don't know that just estradiol is not the only thing that causes hot flashes and difficulty sleeping. Testosterone could cause hot flashes too. Dropping or dipping, you're not used to that level and the body's responding to it. Here's vitamin markers that I run on there. Methylmalonic acid, B12, vitamin C, B6, methyl citrate, paradoxic. There's B5, B6. Here's some malabsorption markers if you're not absorbing. Here's some neurological markers, which is pretty cool. You can run all this. It's so easy. You just sit there and just say, I'm done. That's it. You're done. Ammonia, cystathionine, glutamine, taurine, tryptophan, tyrosine. When you're dealing with sensitive 7, allergies create what? Histamine, right? So if you're allergic to something, you're going to raise your histamine, and your histamine is going to affect your sleep. So your sleep difficulty could be from an allergy. So those 7 there, yeah. So there's a couple of allergy things in the test that I put in there. Enzyme deficiency. I had a lady come in last week. I did a Acera on her. She was deficient in 6 amino acids when we ran the test. 6 amino acids. She's like protein starved. I don't know how she was protein starved, but she was protein starved. Then hormonal imbalance. Find out the hormones. These are a listing of all of them. You can run all those on there and see which ones you have the problem with. Tips for a good night's sleep. Obviously set a schedule. Go to bed at a set time each night. Get up at the same time each morning. Sleeping on weekends also makes it harder to wake up early on Monday morning because it resets your sleep cycles for a later awakening. Exercise, get your serotonin level up. Try to exercise 20 or 30 minutes a day. Helps people sleep. You don't need an hour. You don't need like 80, 90 minutes. You just need like 20 or 30 minutes for exercise. Avoid caffeine, nicotine, alcohol. Easier said than done. Avoid drugs or drinks that contain caffeine, chocolate, soft drinks, herbals, all that stuff. Relax before bed, and then a warm bath, reading, another relaxing routine can make it easier to fall asleep. Sleep until the sunlight, if possible. I don't know if that's possible in Michigan, but wake up with the sun or use your very bright lights in the morning. Sunlight helps the body's internal clock reset. Don't lie in bed awake. If you can't get to sleep, just don't lie in bed. Do something else like reading, watching television, not in bed. Control your room temperature. Temperature is a big one. Maintain a comfortable temperature in the bedroom. See a doctor if your sleep problems continue. If you have trouble falling asleep night after night, if you're always tired the next day, you have a sleep disorder. And I talked about a lot of different things that can cause sleep problems, but sleep problems can not sleep problems, but fatigue, tiredness, all that stuff. A lot of infection can cause that too that I didn't mention on here. That can cause fatigue and tiredness. Infection's a big one because the body releases certain chemicals that make your brain tired when you have an infection, or you get a flu shot, or or something like that. Anybody have any questions?
With sleep, what does dreaming have to do with sleep?
Dreaming is your REM.
That's for, yeah.
Yeah, it helps reset everything. They call it desynchronized sleep, and it's your beta cells, and basically there's a lot, it kind of gets rid of your emotion, because we carry around a lot of tension, so it's more of a stress
Is
reliever.
there ways to dream more, to put more attention? I mean, literally, I take like 10 minutes with him and I sleep with it over my eyes so I don't catch the
I
daylight.
don't know, I think that's where mushrooms come in. All your psychedelics.
Brownie.
Brownies. No, but basically, B1, yeah, there's a lot, I mean, there's a lot of things you can do, but basically what you want to do is you want your sleep cycle to be consistent. That's all you want. I mean, then you'll dream all you want. Night terrors, usually B6 in the middle of the night, helps with that because people get stuck in that, you feel like you're, like a nightmare on Elm Street and you can't get out. Because your body doesn't know the difference between fake and real.
It's like sleep is a level of consciousness, dreaming is a different level of consciousness, and awakening is a level of consciousness. And there's a few more.
Yeah, so, what else?
How long does it take you to change your sleep pattern? Like if you're used to getting up at, say, 8, and you want to get up at maybe 7 or earlier, how long does it take you to change that?
Geez, that could be up to 6 or 8 weeks.
Pardon?
6 or 8 weeks. Consistency and not feeling tired and like you're dragging. To get used to it. Yep.
So, Dr. Krygier, what's your approach when someone comes in and says they're having problems sleeping? Is it straight to an Syria test, or?
Yeah, usually I do the Acera test. You listen to the patient. You have them fill out the form if they're having too much, trouble getting to sleep, staying asleep, or they're sleeping too much. You try to, or if they have restless leg syndrome, stuff like that. Then you can go from there, and then you can do the Acera test. You could do the temperature reading. You could do a bunch of different stuff, and then you put them on a program. Okay?
What is that, a Sera test? What do you do?
You hold it, and it runs frequencies through you.
Oh,
The Acera has 5,000, basically it's a frequency library. Everything in nature has a frequency. Like the neurotransmitter serotonin. Serotonin has its own frequency, and it's in that library. And what it does is it runs through you and sees if the software checks and see if it changes your waves. It changes your nervous system. And if you're balanced, it just passes through you. If it's overly active, it'll be red and it tells me there's something going on there. If it's yellow and the waves under 50%, then it tells me that there's some type of degenerative problem there that's been there for a long time. So it's an easy, non-invasive way to test anything you really want to test as far as your neurotransmitters and stuff. You can do, in fact, you can do bacteria, viruses, you can do all kinds of stuff because everything has its own frequency. But the main gist is to challenge the nervous system and to see how you respond, and that's what the software does. Yeah.
How do you do the temperature test for like thyroid?
Yeah, just put it on your tongue.
But is it first thing in the morning or before you get about, how do you do it?
Yeah, you do your basal metabolic rate when you first wake up. You don't move, you just grab the thermometer. And you do that for an average of 5 days, and then you average it out. And if your temperature is below 97.8, your thyroid's under functioning. When your thyroid under functions, you're not turning over the enzymes in the body because your body needs heat.
Well, mine's
Okay.
almost 97 something anyways.
So 97.8 is
So
the,
that's telling me my thyroid is.
yeah, it's the critical temperature. If you're below that, it's under functioning. It's not a good test for over functioning, it's just for hypothyroidism.
Is there a supplement for that?
Yeah. Yeah. there's-
Well, I take the low
Iodine?
thyroid, so
Iodine's a
should
good
I be
one.
taking low thyroid? I mean, I've taken thyroid medicine and it's still there.
Yeah, so you might want to look at, sometimes you have to, you can prep the body with a little bit of CoQ10, raise the metabolism a little bit. You gotta find things that raise the metabolism. It might not just be the thyroid, but CoQ10 has been known to push the metabolism a little bit higher with the thyroid medication. There's a couple, outstanding things you can do. The iodine seems to do a good job if you need it. Armour thyroid or a thyroid, a pig thyroid seems to do real well too. Just depends if it's TSH, T4, T3. You gotta look at all the numbers. And then you just plug in where you think it would work. So. Anything else? Well, I'll be around if you want to ask me any other questions other than that.
Zero drawing?
Yeah. Why don't you do it, Paul?
Carry it up and keep it.
Why? Helen?
Yes. Or did I win?
What? That's Sarah.
All right.
I do those all
And then Sherry Richards.
Yes. I love those, you just sit there.
And I put 20 of them in there too.
You're like that.
I know your wife won.
That's great.
Yeah, she won. It's not gonna help me though.
Yeah, so those two for the series, you just come in, I run the Asera on you and do a program and
I do that.
just go from there.
I love these things.
It's a cool.
That's pretty neat. So
It
it
is.
actually runs,
I love this
it
test.
compares your different, like serotonin, everything else. It compares yours to what's in its own library, which is supposed to be normal.
Right.
And does it try to bring yours up at all, or just monitors it?
Well, that, you can do it through homeopathic too, but I'd rather do it through supplementation.
Okay,
But I give the homeopathic anyway.
Okay, but the actual Ceradose, it's got its own values in there for
Yeah.
certain, and it just compares the variance between where yours is at and where it should be.
Right. And if it's balanced, it's green, it never shows up. If it's imbalanced, it's either overactive red or underactive yellow. So, and then I never go off of one parameter, but it's got 5 or 6 tests that overlap each other, so usually you see a pattern. You'll see thyroid will show up at least 2 or 3 times. The way I have the testing, just to show up one time could be freak.
So then, like the thyroid could affect maybe another, say serotonin, for example. And you can see this, so if serotonin is low compared to what the norm is,
Yeah.
and then if you have something with the thyroid, and the thyroid could affect, say, the serotonin, and that's how you kind of cross-reference it, or
Well,
zero in more.
It's you can cross-reference it all you want. I mean, there's so many, intricacies in the body, but when it just tests serotonin, it's just testing serotonin. So, that neurotransmitter should be able to be made, stored, released over the synapse, and then cleaned up. So there's a whole process to it. Okay. Thanks for coming.